My name's Vicky. I'm a project manager for Wessex Academic Health Science Network, working in medicines optimisation, which is a quality improvement work stream. I went to Cambodia as an Improving Global Health Fellow in 2010 and worked on a range of programmes while I was out there. The IGH programme is primarily a leadership development programme, but it's achieved through sending fellows on overseas placements to do service improvement work with partners in countries that are developing their healthcare economy. They're improving healthcare through sustainable projects, and they're also developing their own leadership skills and quality improvement skills, which they then bring back to the NHS. So when I went out to Cambodia, I went out with a specific aim to practice new leadership behaviours, to work in a different way. And I think for me, a number of outcomes came from it. I felt that communication skills improved hugely. Working through interpreters makes you really slow down and think about what you're saying and how you actually communicate with the people that you're trying to work with. I had an amazing experience where I had a conversation with a traditional birth attendant. We couldn't speak each other's languages, but we absolutely were talking to each other, even though it was through an interpreter. Running projects that were completely different from my normal area of practice. So having come from a paediatric nursing background, I was working on projects to do with family planning, to do with validating maternal mortality data, started working with traditional birth attendants around, amongst other areas. And coming back, I really wanted to continue that leadership development journey. I applied for and was successful in getting a Florence Nightingale Foundation scholarship. I think the placement in Cambodia really gave me a chance to experiment with my leadership behaviours and being different myself. I think when you've worked in a particular area and with a particular team, they all think they know you, and I think you behave as you think they might expect you to. So going to Cambodia and having had a good think and plan about my leadership development and what outcomes I wanted to achieve, I was then able to go there and say, okay, I'm going to practice perhaps being more assertive, I'm going to practice being more reflective, I'm going to practice just being somebody a bit different and see how it is. And of course I found out that it's actually fine, and nobody suddenly looks at you and says, oh, you don't normally behave like that. And also it made me think how we don't have time to do that in England. Life goes so fast that you miss a lot of those little communication things. So big learning experience for me, and a real seminal moment that stayed with me vividly, because that was over 4 years ago now, and I can still picture that afternoon. I think the IGH programme gives people a new set of skills, or not a new set of skills, but enhances innate skills that they already have. And I think through that and through exposing themselves to something that's different in terms of a different healthcare environment, perhaps an area of expertise that they're not used to working in, gives you a more rounded view of how healthcare can work, and perhaps how the NHS can work. So when you come back to the NHS, you bring back some of those, some of that learning. So you bring back an enhanced set of skills. You bring back a different perspective on how things work and how things could be. You bring back service improvement skills because you've actually run defined projects. And I think all of that goes into, if you can use that in your roles going forward, which is obviously the objective, you can improve quality of services to make things better for patients. From my perspective, I've gone into project work and quality improvement work, so I've used those set of skills for that. I've also taken on roles of mentoring IGH fellows. As part of that, I've done MBTI training, which obviously works and is useful for other groups. So all of that contributes to developing people for the benefit of patients and the delivery of NHS services. I think the IGH programme is unique. I think sending people to developing countries with the remit of improving services whilst you're developing leadership skills is a unique combination. I think people would come back from that with a dual set of skills that perhaps other programs wouldn't provide for you. The fact that you're in an unfamiliar place, working with a different culture, perhaps people that you can't communicate with verbally, it's all very different. The healthcare systems are nothing like the healthcare systems you're used to. So you gain a greater understanding of how lucky we are here, but also how you can change things, how you can develop services. And if you bring that back to the NHS, then you've got a set of skills that you can use to improve services here. I would recommend it to anybody who wants to develop their leadership skills, possibly has an interest in service improvement, quality improvement as well. But actually, for me, the primary development of leadership skills through doing overseas placement then led on to using all the other things that I'd learned while I was there. So anybody who's prepared to take a chance or do something a bit different, go and work overseas, I would recommend it for. But I feel very strongly that primarily it's about developing people's leadership through doing something completely different in a different setting.